So what are the options available for a primary total hip replacement as if we think of acetabulum? So we are thinking of choices and considerations for acetabulum in primary THR. So role of acetabulum component in THR. The acetabular component in total hip replacement plays a very crucial role in overall success and functionality of the prosthetic joint. So the main role includes support and stability, load distribution, range of motion, wear resistance, good bone integration, and we can customize it. So types of components which are available with a metal on poly, metal on metal, ceramic on poly, ceramic on ceramic as well. So if we talk about metal on poly, we have cobalt chromium, stainless steel, and another version we can say Organising is also there for metal on poly. What are the advantages? Proven long-term outcomes, cost effective, it is very cost effective. Disadvantages is wear and tear over the time. What about metal on metal? Nowadays I think no one uses metal on metal. So cobalt chromium alloys, advantages were lower wear rates, better durability. Disadvantages what? Metal ion release, high risk of complications. So ceramic on poly, this is the most popular. We all use and like it. Ceramic on poly, advantages reduced wear rates, lower risk of osteolysis. Disadvantages, higher cost, risk of ceramic fracture is there. So another component available is ceramic on ceramic. Advantages are minimal wear, very low risk of osteolysis. Disadvantages are higher cost, potential for ceramic fractures. So if we talk about cemented versus cementless acetabulum component, so what are the advantages of cemented? Immediate fixation, suitable for elderly patients where bone quality is weak, so we can consider cemented in that. Disadvantages are potential loosening over the time. We have seen a lot of patients where over the period of time cement cup gives up. So cementless cups, advantages are better long-term fixation, biologic ingrowth. Disadvantages are require good bone quality. If osteoporotic bones, cup messing, so we will like to avoid using it. And sometimes it takes longer duration for osteointegration. So this is an example of cemented cup. So fixed versus modular cup. Fixed cups are single, pre-attached components in THR, offering simplicity, lower cost, reduced risk of dislocation, but limited flexibility and customization. Modular cups have separate outer shells, liners, allowing for greater customization, easier liner replacements and adaptation to patients. So spherical versus dual mobility designs. Spherical designs are simpler, traditional acetabular components that provide standard stability and are cost effective, but have a very higher rate of risk of dislocation. Dual mobility designs offers increased stability and range of motion by using two articulating surfaces, making them ideal for high-risk patients, though they are more expensive and complex. Factors to consider while selecting the cup: stability, range of motion, patient-specific factors. So patient-specific considerations, if you talk about age and activity level, bone quality and density, pre-existing conditions, surgeon's experience, what surgeon is trained upon, it really matters, and his preferences matters. Outcomes and complications, long-term outcomes, longevity of different acetabular options. Common complication is dislocation, wear and tear, osteolysis, fractures. So let's see what we have converged upon. So if we talk about what we are using nowadays, so if you ask me, if patient doesn't have a budget, there is a economical constraint, I will like to always go for a metal on poly. If patient is having a good economical support, then we can think of going for a ceramic on poly design and uncemented one. Thank you.